And now you're welcome back for our final big story this morning as the conversation takes us into an urgent yet often overlooked issue, period poverty. For millions of girls and women in Nigeria, managing menstruation isn't just a matter of hygiene. It's a matter of dignity, access, and also survival. A lack of affordable sanitary products has led to school absenteeism, infections, and even social stigma. But right in the heart of this crisis, a bold innovation is blooming. And I mean that literally. A Nigerian biochemist is transforming banana trunks into reusable sanitary pads, offering a sustainable and also affordable solution that could change countless lives.
And so joining us to break this down are three amazing voices in this space. First, we have Dr. Alero Roberts. She's a public health expert and associate professor at the College of Medicine, University of Lagos. We've got Joy Mamkwe. She's the brilliant biochemist behind the banana trunk pads innovation. And we also have Chaste Inegbedion. He's the chief period officer at Cynical and advocate for menstrual equity. Gentlemen and ladies, thank you so much for joining us and good morning to all of you.
Thank you so much for having us.
Thank you. Let me get started with you, Dr. Roberts. You are a regular in the show, so I'd like to begin with you with just the basics. How would you define period poverty and how widespread is this issue in Nigeria?
Well, it is very widespread because menstruation is just a natural biological process every female goes through between the ages of about 8, 9, 10 when menarche starts, when menstruation starts, till the final cessation of menstruation, which marks the onset of menopause. So we're just used to it. We're women. We know we're going to go through this, but unfortunately, in many communities, it is still stigmatized. And period poverty, menstrual hygiene management have become buzzwords because suddenly we have realized how much time the girl child loses during the period of her menses when she cannot go to school because basic infrastructure for her to be able to manage her menstrual period is lacking. It was a huge shock to me, in my early years as a lecturer, as a professional, when something that I took absolutely and totally for granted was, brought home to me that for many, 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 many girls, globally and locally, not being able to go to school during your period was a huge disaster. The girls lose so much time and, funnily enough, probably never catch up.
And thank you for that. Let me come to you, Joy, and talk to you about your innovation, which is fascinating, by the way. Banana trunk, making reusable pads out of banana trunks. What inspired this idea, and how did you start from idea to finish? And what's the science behind it all?
Okay, thank you so much for having me.
Thank you for being here.
All right, so I'm a lady, and I'm a lady. I'm a student of biochemistry. I just graduated rather, and what actually inspired it, apart from my research work. Hello, can I be heard?
Yes, you are being heard.
Yes, loud and clear.
Yeah. Okay, so apart from my research works that led to discovering banana trunks as something I could actually use to help young girls in communities in Nigeria and even beyond Nigeria, I realized that millions of girls actually facing period poverty. And definitely, like was said earlier, period poverty is beyond not having access to sanitary pads. Period poverty is absence of dignity. Period poverty is absence of opportunity. Period poverty is absence of equality as well. It also affects the equality. So realizing that this is something that is common, of course, even coming from a home that I can't really call poor, I still struggled with accessing sanitary pads. I had times when I had to use clothing materials to do this. So, and then going to some schools, community schools, and realizing that this is something that young girls are facing and something they're battling with. They are not able to have access to this, probably because mommy cannot buy this. And menstruation wouldn't stop knocking at the door every month. So we have to find a way around it. We have to find a way to stop this, or at least curb it if we can't completely stop it. So I had to start making researches. I was actually working on renewable energy before I stumbled across this. And then I realized that one of the major issues, one of the reasons why we have poverty in high-risk Nigeria is the cost attached to it. So if we can make this product cost-effective, we can have more girls that will have opportunity to have their full days in school restored without missing school on monthly basis, and then missing out on opportunities and other things that are attached to it. So that was actually the major thing that inspired it. If I could solve this problem for myself, I can also solve it for many other girls out there. So majorly what led to me trying to stop period poverty, trying to stop that issue around how can I access sanitary pad every month? How can I use, am I going to spend my money on food or use it to buy sanitary pad? So if I could solve it for myself, then definitely other girls could also, leverage on this and have access to this product. So that was the way to it. And besides, I'm not even the only one. Other of the friends who we work together as a team to create this product.
Well, congratulations to all of you. It's fantastic. I'm very interested in one bit that I want to ask you, Joy, but first let me come to Mr. Inegbedion here. Mr. Inegbedion, in your experience here working as the Chief Period Officer at Center for what now? Judith, help me out. Sanical. How much of a barrier is affordability when it comes to menstrual pads?
Thank you so much. I thank you for the purpose of this interview. You can just call me Mr. Padman, so it's easier to call my name. Yes. I think we should stop sugarcoating it. Menstrual product is a luxury in Nigeria for millions. You know, a single mother in Mushin, where I grew up, told me she chose it between feeding her child and buying pad. This is the brutal reality. The average pad now costs between 700 to 12,000, and there's some pads like Noni that can be as expensive as even 14,000 naira. And that's for non-organic brands like the Always and the Mopeds of this world. And when you're thinking about the imported brands like organic, like the Honey Pots, they can go as more as 14,000. That's outrageous. Girls are bleeding through school uniforms. Women in rural community are still using feathers, they're still using newspapers, mattresses, and rags. And this isn't just about health, it's about human dignity, economic justice, and a system that continues to fail Nigerian women. So affordability should be taken into consideration, and this is a time that even private sector participation should be taken seriously.
Thank you very much, Mr. Padman, but like you asked us to. Now, leading back to Joy, now that we've gotten that answer from you, there's one thing to come up with such an innovation. It's another thing to actually go into full production and be assisted to be able to reach so many women and girls. How has this been for you, that journey? Are there organizations or even the government who are willing to help see that this is mass-produced and every girl child out there has access to at least affordable sanitary products?
All right, so thank you very much. After we started working on getting our prototype ready and then testing it on people and start having some products that are usable, what I could use, of course, that's what I use as well. And then what other my friends can use, people in schools can use. We started getting traction, people started getting interested in what we're doing. My school face became a very massive support for us. Though not financially, but they were able to support us, bring us out to conferences, buy some of our products. And then, so after the news went on Vanguard, we had people calling from different places. Recently, someone called from outside and was willing to invest. Also, the commissioner for SME in Abia State here, where I reside, recently I went to see him, and then he was very much interested in what we're doing. So, but so far so good. We've not really had, we can't really say, okay, this amount of money has really come into this. We've been bootstrapping all the time. We've been using our money to gather things and then make sure that we are not stopping because we've started. And definitely we see the future in it. We see prospects. We believe that this is going to stop this problem or curb it to a very large percentage. And then, so because of that, we are pushing even with our own money. And then we are trusting that people who are showing their interest are going to be part of what we're doing and then help us scale in a larger way. Yeah.
I hate that capitalism always plays into a big role when it comes to innovation, and especially when the innovation is to solve a humanitarian solution or a human problem. But let me come to you, Doctor, from a public health perspective. I mean, there must be long-term consequences of inadequate menstrual hygiene for girls. And so it begs to ask the question why the problem is not mainstream. Is it a policy issue? What are the gaps that is causing this inadequate menstrual hygiene for girls?
Sorry. I think Mr. Pad is in a much better position to answer this because he's definitely on the front line and the trenches when it comes to accessibility, availability, affordability of menstrual hygiene products. But you know, the implications of poor menstrual hygiene, apart from just losing out on school days, which is a major problem for the society at large, is that immediately the issue is that poor menstrual hygiene leads to being at a higher risk of infections, urinary tract infections, reproductive tract infections, which eventually can add to the infertility burden. And of course, we've got the absenteeism, we've got the loss of dignity. I think we really do need to put that front and center for women and ladies. And yes, I'm a woman. I can identify with this acutely, and best still, I'm the first of 5 women in my family. I've got 4 siblings, female siblings, 2 male siblings, but they don't count. So as women, we've felt this. We've listened to mothers, we've listened to aunts, cousins, and sisters talk about this, and we've listened to all the stories of what is termed embarrassing stories, but really are loss of dignity stories. And this is something that we feel that is a policy issue because it involves women. It is just not front and center enough. But now that the fact that women being affected is now affecting men, it is now becoming a front and center issue. And the problem is that we've got to think of these innovative solutions, because that loss of self-esteem from loss of dignity, the loss of self-esteem from inadequate education means that the problem is that we're going to keep replicating this, and it's like kicking the can down the road.
All right. Let me ask Mr. Padman then about the policy gaps that we're seeing. What's causing it? Why is this issue not mainstream? How then can we make it mainstream to close the gaps?
So we're demanding it and not requesting it, a national menstrual policies that include tax-free pads, free menstrual products in all public school, a paid menstrual leave in the workplace. Anything less is a betrayal to millions of women living in poverty. Like when I started this journey, it was pretty much being online on Twitter, which is now called X, a few years back. And it was like, I'd rather get pregnant than buy sanitary pads. Condom is free, why is sex a choice, and tampons is tax. It was that conversation. There was a gender war that was about to happen. Like, if only men were on their period, maybe parts would be raining from the skies. I think these are conversations that pushes the frontiers for policy. Let's be honest, when 65% of Nigerian women can afford pads, and schoolgirls are forced to bleed into mattress foams, old rags, or even chicken feathers. And what we're witnessing is not just neglect, it's a state-sanctioned violence against the bodies of poor girls, against rural women, against women who are scrapping up on $10,000 a month. But we're not waiting for permission. We're partnering with state government, NGOs, and daring innovators like Joy. Look at what she's doing to craft reusable bags from banana trunks. We're proposing solar-powered menstrual dispensers. We're asking for pilot AI bag supply chains with the Ministry of Digital Economy and Women Affairs to track and deliver this product where they are needed the most. And this is the right time for this to happen. And this is also a direct call to the First Lady to embed menstrual dignity into the renewed hope agenda. We don't want this to be another photo op that a lot of people just go to schools or communities and just give out pads. This policy should be integrated. If Kenya can provide free pads in school, Nigeria has no excuse, and that's why we should use platforms like the Menstrual Hygiene Day, which is May 28th, that is championed by Wash United and other stakeholders in the space. And News Central, for example, is doing this laudable job by spotlighting these issues, and organizations like Menstrual Peace Resource Development Centers who are coming together with a revolution. And that's the time for these policies, for us to stop girls who are bleeding in silence, for the women suffering in shame, for a country long overdue, for its redemption through red dignity. Thank you.
Thank you.
Thank you.
I must say, I mean, I wish we could continue with this conversation, but we're way past time here because there's so much happening, unfortunately, in Nigeria. And of course, we have to get on to our reporters. But I must say thank you to you, Dr. Alero, for always accepting our invitation, honoring it, and coming on. We appreciate you for doing this. And also to you, Mr. Inegbedion, also Mr. Padman, who joined us all the way from the overseas in spite of the hours behind. You chose to be awake to join us. And also to you as well, Joy, for your innovation and thinking of a solution at a time where it's desperately needed. We do hope that we'll continue to have these conversations, bring it to the fore, and solutions will be implemented. Once again, thank you.
Thank you, gentlemen and ladies.